BPOU's monthly webinar. I know that we might not have had one particularly last month, but we're having an exciting lineup for this evening. And particularly as we go into the summer season, not only is it just Utah's known for having fires itself, but there are burns that can occur commonly that it's good to have awareness of, but also when to seek treatment and how some of the burns are treated. That being who is served by Trey, but also has completed a burn fellowship. Is that deputy, your deputy chief, or how am I misstating your title
I think you're asking
for
me
the
my
burn
title.
center?
Yeah, I'm Associate Medical Director.
Associate medical director. I
Yes.
don't know why I kept saying chiefs. I
Or
apologize.
Assistant Medical
And then we
Director.
have Dr. And then we have Dr. Robert Teixeira, hand and plastic surgeon, and we are, or much of this presentation is being built by as well and being also co-presented with budding second year medical student Akram Lusonda, who people may remember we had in February. So without further ado, I'll get us underway. Just please note there will be times to ask questions during the presentation. That will be also determined by the presenters when they will pause. Feel free to place questions into the chat. Additionally, when we do come up to the quizzes, once again, it's the right answer when it's determined by the presenters, what is correct, and whoever is first. There may be several people that will choose A or B or C, but we got to go for who chooses that particular answer correctly initially. Once again, you can only get one Amazon gift card per person. So even though you may answer multiple questions correctly at once, please be aware you're still only limited to one gift card. So after all of that, we will still have a Q&A portion towards the end. And I will now hand it off over to Dr. Fleming, Dr. Shara, and Akram to start our burn presentation. Thank you again all for being here.
Great. Thank you, Dr. Ferguson. Again, my name's Akram. I'm a first year, finishing up my first year of med school, rising second year, joined by Dr. Fleming, Dr. Teixeira. If you guys want to give some quick intros of who you are, what you do, it'd be good.
Hi, I'm Irma Fleming. I'm one of the burn surgeons at the University of Utah. I'm basically the person that gets called when your skin is falling off. So that can be from a skin disease, rash, or burn or frostbite. So hopefully you learn a lot. Hopefully this answers some of your questions that you have at home and in your life, because I see people in regular daily life who get burned. So hope you enjoy.
Hey everyone, I'm Bob Teixeira. I'm a hand and plastic surgeon. Dr. Fleming and I sometimes share patients together. I help out when there's big burns that need big tissue transplants or bad burn scarring that require tissue transplants too. So excited for this presentation. It's been in the works for a few months, and student Dr. Lusonda's got a great presentation lined up here.
Thank you. So today we'll be covering burn prevention and education, and let's see if my slides will work. Some of my objectives here, just to define what a burn is, especially at first degree, second degree, and third degree, some of the common causes of burn injuries, some of the factors that lead into how severe a burn can get, and some of the ways we can prevent injuries and burns from happening. So basically, we will not be letting it burn like Usher here at the bottom of the slide. Quick disclaimer though, there are some images here that could be a little bit woozy, or they could make you feel a little bit woozy or weird. They're gonna be showing some burns, some first degree, second degree, third degree burns, or if you're somebody that gets a little bit, queasy from looking at certain images, just know that the next couple of slides, maybe three, four slides, we'll be showing some burn images. So let's start with what a burn is. A burn is basically an injury to the skin. It's caused by heat, chemicals, or electricity, radiation, or friction. And these can range from minor injuries, and they can affect basically from the top layer of the skin down all the way to the bottom layer of the skin. And the severity of a burn is determined by how deep the burn is. So, starting off here with our first degree burns, which are also called the superficial burns. These are burns that only affect the outer layer of the skin or that top layer of the skin, the epidermis. And some of what it might look like is your skin might look red, dry. It could be painful as well. But typically, you don't see blisters, and they usually heal about 3 to 7 days. So you can see on the right here these images, and then here in the middle, you can kind of see how it's a little bit tougher to tell on individuals that may have darker skin. This is just in a way a social determinant to be on the lookout for and kind of be more cognizant of people that may have different skin tones and some of the ways that burns may present to them. So moving on to the second degree burns. These are burns that affect the epidermis and the dermis, which is the layer right below that epidermis. So the top and also the middle layer a little bit. So the skin can also look red, but the differences here is that it can look moist and shiny. And typically this is where you're gonna get your blisters, as you could see in some of these images here. And here it's kind of looking a little moist. Um, they're usually painful, just because nerves are located in that dermis area, that second layer of the skin. So it can cause some swelling as well. Anything you want to add on to about these images or these burns, docs? And if not, that's okay.
You can keep going.
Okay. Oh, so a third degree burn, this is the one that affects pretty much all the layers of the skin. So the epidermis, the top layer, the dermis, and typically can even get down to this layer right below the dermis, where the fat is. So these are usually not as painful, actually, but they kind of look like dry leather, as you could see on these images right here in the middle. And the color may vary. Usually, these are the type that require skin grafts from our surgeons, for treatment as well. So, first question of the night. Why do you think a severe third degree burn may actually be less painful than a second degree burn? Let me open up the chat. I think the first one to answer this will get a okay, because it affects all the layers, because you burn your body. Maybe I'll give it 10 more seconds and then we'll reveal what the answer is. Okay. I like Dole's answer. Hopefully I'm saying that right. Most. And the answer to this question is yes, the third degree burns, they're gonna destroy your nerve endings, which are typically located deeper in the skin. And that's why you typically don't feel as much pain. Um, it's because your nerves are basically completely damaged and there's no pain to feel. So I said we give that to, yeah, Dole for that one. So, and now I'll be going over some of the common burns, that we typically encounter in our daily lives. So scalds, or basically burns that are caused by hot liquids or steam. These are the most common type of burn, and they occur typically in children and older adults. I mean, I remember even as a kid, um, when I was back at home in Africa, we had somebody taking care of me, give me hot baths, and they forgot to check the water, just decided to put me in there. Not my fondest memory, but kind of points at how common these are, really. And then, any place that can really have hot liquids, so hot water, coffees, soups, steam, anything like that. So, second question, how long do you think it takes for 140 degree Fahrenheit or 60 degrees Celsius water to cause a second-degree burn? Open the chat. Hey, that was quick. So maybe I'll give it another 5 to 10 seconds. Oh, I did that too early, but the answer is D, surprisingly. Um, it doesn't take too long for you to, guess something that could be considered a severe burn. As far as the gift cards, we'll give this one to Emily, even though I kind of messed up, went a little early. That's on me. But shout out to you, Emily.
Can I chime in on this one?
For sure.
Yeah, so this is one of the important ones that kind of define a burn. So the depth of your burn is dictated by um, the area that's in contact, but also, and the temperature, but also the time that it's in contact. And extremes of age, like kids, really young kids and really older adults, have really thin skin. So it doesn't take them long to get a second degree, third degree burn. And so when we're talking to parents and families about their water heaters at home, we tell them to set it to less than 120 because to help prevent some of that scalding that Dr. Lusonda mentioned when they're taking baths and keeping kids out of the kitchen, and then making sure just the water temperature is nice and healthy, especially for new parents who are taking kids home.
So I wanted to give a visualizer on some of the common items that could be laying around and kind of the temperatures that they could present as, hot mac and cheese could be up to 200 degrees. Oatmeal 190. Coffee, this is, probably a common one. 150, 1 to 180. Just already above that, like 145 that we covered on the previous slide. So this is more to show that it doesn't take as much as we may think for some of these temps to get high up to cause some damage. Okay, next question. Why are children and older adults at greater risk for some serious burns from hot liquids when compared to healthy adults? And I think Dr. Fleming, you kind of covered this a little bit, so we'll see who just gets it first. Okay, we got B in the chat, and B is the right answer. So Ella will give you that one. Exactly like Dr. Fleming was saying, is their skin is thinner, not as many layers to it. Um, so it's not as protective as your average healthy adult. So the next type of burn I want to cover is contact burn, basically touching anything that's hot, coming into contact with this. A flat iron is probably like a common one, or a curling iron. And the severity is, again, it's going to depend on how hot the object is and then how long it's staying on that skin. Typically, when people touch these hot irons and curling irons, it's a quick, a second maybe of exposure. So that typically prevents severe injury, but still something to be aware of. If something is extremely hot with a high temperature, it doesn't matter how little of time you spend on it. Still some chance for some injuries. And then chemical burns. These are burns that occur when the skin or eyes they come into contact with the corrosive substances. So these can be things like bleach, most commonly, probably the most common type of chemical burn, especially in the eye. And this is what it can look like in this picture here with the eye. Um, not fun at all. These are something that you want to definitely go and seek medical care if you can. And then flames, this is more of a little bit of an obvious one, but I learned yesterday that it's actually pretty common for people to fall into like a campfire, for example, and get serious injury from that. So definitely just still something to be aware of. Maybe when cooking, um, leaving the stove on, that could be also a danger as well. So just things to watch out for. Okay, next question. What is the leading cause of house fires in the United States? Quick. We got an A, a D, and two D's. Okay, B with a C, and that is the correct answer. Actually, it's cooking related incidents. These are, I think, by far the most common, cooking related incidents like burn injuries. Um, so definitely important to watch out for stoves, keeping them off when you're not using them. Keep children away from them if you can, because they can turn out to be really bad. And so some other things we can look at when trying to prevent, burns and fires at home is keep the hot foods and beverages away from the edges of the tables, just because it makes it's easier to contact them if they're on the edge. Turn the pot pans inward when cooking. This is a big one. You don't want to bump into it and spill things that you could be cooking. Some oil, maybe that could be pretty bad. And then again, like Dr. Fleming was saying, we're saying is setting those heaters to around 120 degrees. I think is about the general recommendation, or lower if possible. Testing the bath water before bathing children. This is personal to me. And then keeps matches, lighters, flammable materials just out of reach as well. So I have a video. Hopefully it plays. And
This is how fast a house fire can spread.
oop, my bad.
This is how fast a house fire can spread. There's always something that I've done. I don't wanna expect every word you say. Said that you could let it go, and I wanna get to know somebody that you used to know.
I mean, you can see how quickly that was less than a minute, and basically the whole room, the whole house was on fire. So just kind of putting into perspective how quickly some of these things can escalate. It just goes back to the previous slide of trying to practice these prevention and safety measures, um, to try to help out prevent house fires from happening. So, if there was a need for you to be able to escape in case there's a fire that actually happens in a home or any area that you may be in, it's important to know where your exits are. Know at least two of them should be in every room. Get out as soon as you can, call 911, safe location. Um, and this is a big thing here is crawling low if you can, because up the smoke can actually be a danger to you, as you're maybe trying to get out of a situation. So crawling can actually be really helpful in trying to prevent any injuries or damage that could happen. Close the door behind you if you can, and yeah, basically escape and try to call for help. So next question, what is usually more dangerous in a house fire? That was quick. Khadija, we're gonna give you that one. Smoke is usually the most dangerous, one of the most dangerous things about a fire, but we'll talk about that in the later slides here. One thing I want to emphasize is how important it is to really keep up on the smoke alarms in your home or wherever you may be frequenting, because these basically reduce the risk of dying in a home fire by approximately 50%. So basically every room should have these. They should be tested monthly. Replacing the batteries should be done at least once a year, unless they're long life batteries, and then replace the entire smoke alarm every 10 years. This, it may seem a little tedious to kind of check smoke alarms every month, but kind of just do your best here, as they could be really helpful in preventing serious situations. And then carbon monoxide alarms. This is another big one that some people may overlook, but carbon monoxide is basically a colorless, odorless, tasteless gas. So you can't see it, you can't smell it, you can't taste it, but it's actually the number one cause of accidental poisonings. And basically, what it does is it makes it really difficult for your body to deliver oxygen to its organs and its tissues. So it can be really dangerous. And carbon monoxide, can be found in house fires, gas stoves, generators, vehicles running in enclosed spaces. So like a garage, if you have a vehicle running in a closed garage, that could be potentially dangerous for this. So that's why it's also important to install carbon monoxide alarms that can detect when there's levels of carbon monoxide, since it's really hard, it's not as easy to detect as, a smoke would be, since you can typically see the smoke and sometimes smell it. So I would say this is pretty much just as important as the last slide.
Can I chime in here?
Yeah.
Okay. In addition for house fires, in addition to the carbon monoxide that becomes a problem, you get products of combustion. So the curtains that are burning, the couches, the carpet, all of those things that are burning can produce cyanide. And a lot of times we see patients with what's called cyanide toxicity. And the smoke they're inhaling actually causes what's called an inhalation injury. So they can have no burns and still potentially die from just inhaling smoke. So that's how big of a deal smoke inhalation can become. And we see that a lot, especially here in Utah. People want to go back in for pets. Your pets, don't worry about them. They know how to get out. They do perfectly fine. And really trying to keep yourself out and away from smoke can save your life tremendously. They call burns the walking wounded, because a lot of times you're not going to die from the burn. You're going to die from the smoke inhalation at the scene. If you can make it to me with the burn, then we can usually, depending on how extensive it is, get you through it. But the minute you start inhaling smoke, that increases your likelihood of death.
Now we have a question in the chat here. What is the cause of white spots on the body and what are the cure for it? This is a question by Ella. It's a little bit of a general broad question, but maybe you can tell me a little bit more about what you mean by white spots, or maybe docs, if you know the answer to that one.
I don't know what's meant by white spot.
Yeah, I think we need some further clarification.
Yeah, we could do that. We can move on, and then if the
I
clarification.
wonder if she were referring to how the skin will appear when it's a third-degree burn.
Like third degree,
yeah. And it looks white. Maybe that.
Yeah. So it's essentially just the burning and charring and leatherizing of the skin. So there's no more blood flow to the area. So anywhere that has no blood flow is going to look pale or white. So that's what you're seeing. And then the dermis, your next layer under your epidermis, looks white also. So if you're down to the dermis, it may look white, but also if there's no blood flow to the area and it's just burned deep and charred, it's going to look white or pale. Does that answer your question, Dr. Teixeira? Do you have anything else to add?
And I think to answer the question 4, like how do you cure it? Normally it requires surgery to cut out that area and eventually skin graft it.
Yeah.
Great. So in the worst case scenario that somebody gets burnt, what do we do now? This is something you can think of quickly like the 4 C's. I'm going to cover the first two in this first slide here. But the first C is cool. So try to cool the burn in any way you can. Cold running water for 20 minutes. This is going to help clean the site and reduce the risk for infection. So try to remove any, jewelry or watches, tight clothing that could be near the burn, and try to wash out. Try to kind of cool it down. Importantly, though, don't use toothpaste or home remedies or butter. They could have some irritants to them, which could potentially make the situation worse since your skin is now exposed. The next C is for cover. So try to cover up the burn if you can with a clean dressing or a cloth. There's some gauze around or some band-aids that can fit the size of the burn. Try to cover it up after you clean it to further protect it from injury and contamination. And then the third C is call, which is seek medical attention. If it's a large burn, burns to the face, hands, feet, genitals, or major joints, electrical or chemical burns, or any burn causing concern. So to kind of build on this, docs, what degree burn should someone be cautious of and try to, seek medical help? First degree, second degree, third degree? Does it depend on what it looks like?
Yeah, honestly, it can be any degree because, say, for instance, I get called even with first degree sunburns. If there's a kid that's been outside for hours and hours and the majority of their body is sunburned, they can get pretty dehydrated and feel and be in a lot of pain too. So I do get patients that come into the hospital for a really bad sunburn or first degree burn that can eventually burns do what's called convert. So in about 24 hours, it can actually become a second degree. So that first degree sunburn can blister and become a second degree burn. So we can see that too. So it depends on the extent of the burn, but also anything that's blistering, you should at least touch basis with somebody as far as wound care. And it can be clinic. It doesn't mean you have to be admitted to the hospital, but you can be seen in the emergency room fairly quickly. You can be seen in a clinic, and then we can give you instructions on how to take care of it. Special areas like the face, the hands, feet, genitalia, and over joints, those are the times we also tell people to reach out and get some assistance too. And that can be between us or plastic surgery too. A lot of places may not have a burn surgeon available, but there is a plastic surgeon available that can actually.
Definitely. And then that
I
fourth C is,
think
go ahead.
another time to seek attention for is actually with house fire. Say you didn't get burned, but smoke inhalation's a big thing, as Dr. Fleming mentioned earlier. So that's something not to forget.
Yeah, and going back to the cooling, um, I've gotten people pretty much baking a cake on their burn wounds. They will put mustard, flour, butter, oil, every eggs. I've had scrambled eggs on burns. It just people will put everything and anything. And I grew up, I much of my training was in the South. So anything that was in the kitchen was going on that burn. And when we tell people to cool the burn, make sure it's not cold. No ice. You can turn a burn into a frostbite very quickly, and then that makes the burn even deeper. So yeah, so definitely you just want to stop the burning process. That's what we mean by cooling the burn. Stop the burning process, whether it's a chemical, whether it's a flame, just stop the burning process with cool water.
And then Khadijah, do you have a question?
Yeah. For some, like, not necessarily burns, but like for some people who get like surgery and they end up going to like the wound clinic, they have to get like vacuums. Sometimes they like open the wound and like peel the skin to kind of like help it um like heal faster, or I'm not sure. But is that the same with the burns? Like, I mean, after cooling and everything, the healing process, do you have to like re-peel off certain like skin layers to allow it to heal, or does that not happen?
Yeah, we do. So,
Okay.
as a part of cleaning the burn, you do want to get off any debris. One, there's usually, if it's happening outside, there's dirt, there's debris, there's smoke, there's ash all over the patient. But you want to clean off any dead skin because that skin that's burned no longer has blood flow to it. And so you need, if you leave any dead skin or dead tissue, bacteria tends to want to settle in there. So you do need to clean the wound by actually removing off the dead skin, which is the one that's usually kind of blistered up or actually just sliding off. And then once you remove that dead tissue, that's when you can actually put your topicals, your creams, your antibiotic ointments, all of those things can actually penetrate and reach the base of the wound without having that dead layer sitting on top separating it.
Thank you.
Okay, and then the fourth C is just comfort, trying to reassure the person, staying hydrated. Maybe counterintuitive to stay warm, but once that burn is kind of cooled off, I think you can then start to worry about some other things and try to keep the person warm as well. And then over-the-counter pain meds if it's painful. Okay. Sadly, we've reached the end of the presentation, but do we have any questions from people that we can quickly address and answer?
I think someone in the chat asked about black spots, like hyperpigmented areas. Is that what you're asking about? Or scars? Or moles? There are a lot of different black spots.
Scars, they say.
Okay. You want to start off, Dr. Sharon? I can add some burn
Yeah.
scar stuff.
So with scars, there are all sorts of, it depends on the cause of the scar, I think, is one thing. Two, it depends on what the scar is causing. Is it just a pigment problem? Is it causing something called contracture, where the scar, um, causes the joint not to be able to fully move? Um, Oftentimes, if it's just a darkly pigmented scar, sometimes we can consider cutting out the scar and replacing it with some other local tissue, or if we need to, we can transplant tissue. That said, if it's like a small area of scarring, sometimes you can just cut it out and close in a straight line, or then sometimes there are lasers that can be used too. I know our burn surgeons have awesome experience with that at our institution.
Yeah, we also do lasers for scar. A lot of it is more, our laser is CO2 fractionated laser. It helps a lot with texture and redness. When we start to get darker scars, there's a few different things we can do. We try to tell patients not to use like bleaching agents and things like that to lighten up the scar. Actually, cocoa butter works really well. And people are really surprised that cocoa butter and sunscreen work really well. But in addition, there's a bunch of different like microablations and different things and techniques you can do to lighten up the skin area. But when it comes to burn scars, you don't want, especially if you got a skin graft, you really don't want to traumatize it a lot with different things and chemicals that really strip that tissue. So yeah, you want to be very careful. But if you just mean like hyperpigmentation, there's different topicals, lasers, keloids are a whole nother subset of things and ways to manage. That's a whole nother area to deal with. So yeah, so it just depends.
I think the next question was, what's the longest a burn can take to heal?
For first and second degree, usually it can heal within 21 days. So up to 21 days, we'll potentially give a burn to heal. So if it hasn't healed within 3 weeks, usually we're talking about a skin graft for a second degree that hasn't healed, and that's like a deep second degree. After that, it just depends on how deep the burn is and how extensive it is. If you have 80% of your body burned, you're going to be in our burn center for several months. If it's just 1% of your body, it may be a couple days. So it just depends. And it also depends on if you need a skin graft or not. So if you can heal on your own, then it can heal within a couple weeks. But if you need a skin graft, that's going to take a bit longer. So it honestly just depends on the depth. There's another degree of burn called a fourth degree burn that he didn't mention. We see that a lot of times with electrical injuries. That's down to like bone, tendon, muscle. And that's usually either when I'm calling Dr. Teixeira to help flap or we're having to amputate. So it honestly just depends on how deep that burn is, will dictate how quickly it can heal.
Next question was, could you talk a little bit more about the correlation between severe sunburn and dehydration?
Yeah, so your skin first is the largest organ of your body, but your skin loses heat and moisture evaporatively. So if you're out in the sun all day, you're just evaporating and losing fluid. A lot of people aren't rehydrating while they're sitting on the beach or standing outside or hanging out. And if they are drinking, it's probably liquor and other stuff too, or sugary drinks. But also your skin starts to swell and it takes water into your tissues too. So inside the body, it kind of loses fluid, but outside the body, you'll be all puffy and swollen. So you'll get a dehydration from two aspects, you just evaporating and just being dry in general from dehydration and not drinking, but also your skin and your tissue is just absorbing water because it's so inflamed from just being burned and irritated. And anything that gets inflamed, it holds water. That's why when your joints are inflamed, you see swelling. That's why when you fracture something, you see swelling because of that inflammation. So if you get a big sunburn, you can get a lot of inflammation and swelling. And a lot of patients can come in pretty dehydrated. If there's anything else, Dr. Teixeira, you want to add?
I have a slightly different pitch to make, especially as we approach the 4th of July and also in Utah's specific holiday of Pioneer Day. It's that people have fireworks are a big deal here in the Mountain West. And as a hand surgeon, I unfortunately have to take a lot of digits and whatnot for people holding fireworks and then exploding. And then, but the other thing though is that fireworks can also cause burn injuries too. Sometimes if it happens in a room, they can blast out their eardrums. They can get ash or little superficial burns of their belly wherever they were holding it. So please, my PSA, because I'm on call for the 4th of July, is that if you're doing fireworks, you're not having them in your hands at all. They're being lit from the ground and you'll be a distance away. Or better yet, don't do them at all. Go watch them.
That includes sparklers. Sparklers can get really hot too. So, and then I think there was another question about the rule of nines. So the rule of nines is a rule in the burn education where it's a quick way of estimating how big a burn is. And so we kind of we divide the body up into percentages of 9% of that area. So an entire arm, maybe 9%, a face, an entire head is 9%. Your torso is 18%. So that's two nines, 9% areas. And the back of your torso is 18%. So it lets us kind of walk into a room and just quickly assess how big a burn is. And that dictates, one, how much fluid that patient may need in order to resuscitate them for their burn injury. And then when it comes to the percentage of body that can be burned that has the highest mortality. So burn mortality is based on what's called a BPOU score. A BPOU score takes into account the patient's age and how big a burn is. So a 5-year-old with a 60% burn will have a higher mortality, even though they're 5 years old. It's because that burn is bigger. But because they're 5, they'll have a better mortality than a 90-year-old with a 10% burn. Just because that patient is much older, but even though it's a smaller burn, that age plays a big part in their survival. So it's a function of age and burn size, but the younger you are, the better your survival. Hope that answers your question.
It did. Thank you.
Great. Question I have actually is what does treatment look like for someone in a burn unit? Um, on like typically kind of a
Yeah.
broad question, but
It is a broad question. Burn is unique, and I love it because I think burn is the only holistic medicine in the hospital. Granted, I'm biased, but I really do think it is the only holistic medicine because we treat the entire patient from head to toe. I have my own pharmacist. I have my own dietitian. Have my own physical therapist and occupational therapist. I have my own child life specialist. We have pet therapy that comes up there, music therapy that comes up there. I have social workers that do mental health therapy because that's the other component. Around the holidays, there's a lot of suicide. So mental health and people tend to set themselves on fire. And so a lot of mental health component goes into burn reintegration into the world. So I think being in the burn center is like the biggest cocoon that you could be in because you have somebody that helps with every aspect of your life. And we have people there to support the families too of these patients. So I think it's the most integrative, multidisciplinary, interdisciplinary care that you could have. If I take out your gallbladder or if I take these other parts of you out, people just go home after that. And that's it. There's nobody checking to see how you're doing, how you're eating afterwards, how you're doing back at school or at work. Like these are the parts that burn we do. We have burn camps also. A lot of our nurses and team volunteer at burn camps for kids and adults. We have a rafting trip. We do archery, climbing seminars. So we really try to give people a sense of normalcy in their life after a big trauma.
thank you. That was great.
Mm-hmm.
I can't agree with you more, Dr. Fleming, on that point. As someone who consults with some of your patients, like I truly, in a way, I'm a little jealous, right? That you guys have such awesome, you're able to care for the whole patient. And it's truly like one of the gems in the hospital. So
Hey, do we have any last minute questions before we wrap up here? When is the next webinar? Gonna have to check the BPOU site.
It is July 16th. It'll be at 6 p.m. with Dr. Devin Langston and Tyler Thompson. It'll be on Black men's health in the community. And everyone that received or that is guaranteed a gift card, you'll get an email this week with your e-gift card. And also please note that within about 3 to 4 days, this webinar, which has been recorded, just needs some time to edit. It'll be on our YouTube channel as well. And so for anyone that missed it, or if you want to share with someone, it will be there. And it'll eventually also will make it to our webpage shortly after that. So I want to thank everyone for joining us this evening. Hopefully everyone took away some tips on how to protect themselves at home in this summer. So you don't necessarily have to go and see Dr. Teixeira or Dr. Fleming.
Yeah, you never want to meet me in the hospital. Thank you. Good job, Dr. Lusonda.
Yeah, thank you. Thank you everyone for joining. Hope you have a great rest of your day.
thanks, everyone.
Thank you.
On behalf of BPOU, thank you for joining. Have a great day.